Hello, my name is Anne McManus, and I am a nurse practitioner at the Faulkner Breast Center. During this video, I will discuss some information about your surgical experience at Faulkner Hospital. Prior to your surgery, you will meet with a nurse at the Center for Preoperative Evaluation and will have the opportunity to discuss your previous surgical experiences, review your medical history and current medications, and discuss any concerns you have about anesthesia. This is done to ensure that the day of your surgery is as smooth as possible by having all of your data reviewed and preparing you for what to expect. If your surgery involves removal of a lymph node in your axilla or a mastectomy, you will meet with me to review some additional information and have the time to have your or your family's questions answered. Breast surgery can be a physical and an emotional experience, and oftentimes a family event. I would like to review some of the physical aspects of breast cancer at this time. Your surgeon will review how to care for your incisions with you. Many times the stitches will dissolve and you may shower the next day if you do not have drains. If you have drains, you will be instructed in drain care and offered a visiting nurse. Jackson Pratt drains are placed to remove fluid from the mastectomy incision. This portion of the drain is placed during the surgery and attached to this bulb by this tubing. Drain should be collapsed at all times to create the suction. You will be instructed on the time frame that drains should be in. Drains are usually removed in about a week or until the amount is less than 30 milliliters in 24 hours. If reconstruction is done, the drains are usually in for 10 to 14 days, and your plastic surgeon will remove them. If you have a mastectomy with reconstruction, you will receive a jackie, a garment to hold the drains. The pockets are placed so that the drains can be inserted. You will have an appointment to come in for drain removal with me or your plastic surgeon when the drains are ready to be removed. If a mastectomy without reconstruction is done, you will be visited in the hospital by New England Medical Fitting and given 2 camisoles, garments to hold the drains. You will be given information on prosthesis fitting, which can be done in approximately 4 weeks after the healing is completed. You will also be fitted for mastectomy bras, which are covered by insurance. Do not use deodorant until your drains have been removed or for about a week after the lumpectomy. If you have a mastectomy, you will be admitted to the hospital for 1 to 2 nights, longer if your surgery includes reconstruction. All of our inpatient rooms are private in order to allow you to rest and recover more easily. With a lumpectomy or axillary surgery, sometimes fluid is collected around the incision. This is normal and will resolve, but if it is a large amount or if it interferes with your activity, contact your physician or nurse practitioner. It is advised to use ice on the lumpectomy site and the axillary site intermittently for 2 to 3 days, and wear a bra day and night for 3 or 4 days. You will be given contact information for the on-call surgeon for evening and weekend coverage, should you have questions during off hours. Exercises have been developed to protect your arm and shoulder from becoming stiff or immobile. All of your care providers have worked together to create a safe and effective regimen. Start the exercises the next day per the instruction of your surgeon. It is important to resume your exercise program slowly following surgery. Types of exercises will be reviewed later in this video. Lymphedema is swelling of the hand or arm following lymph node surgery. The risk is low and is minimized by prevention of infection and treating any swelling early. Recent research has established that early exercises and gradual return to exercises helps prevent lymphedema. Most breast surgery requires 2 to 6 weeks to recover, depending on the type of surgery you have. You should avoid heavy lifting, but move the arm to avoid a frozen shoulder. You should return slowly to your previous exercise program and call if movement is limited. Take pain medication as directed and as needed. Anesthesia and pain medication can cause constipation. Have a stool softener or laxative available to help control discomfort. With lymph node surgery, numbness in the axilla or the upper arm can occur within a week. This should resolve within a few weeks, depending on the number of lymph nodes affected. In some women, a burning sensation can occur in the arm or the chest wall approximately 2 to 6 weeks after surgery. This is caused by nerve endings and is treatable with medication. If this is present, call your physician or nurse practitioner. Pathology reports will be available in approximately 7 to 10 days following your surgery. Based on these reports, your physician will call and set up the next steps in your treatment process. You will be given an appointment for consultations with a medical oncologist and a radiation oncologist, or both if appropriate. Modalities of radiation or chemotherapy will start in about a month after the surgery. 30% of lumpectomies require a re-excision for clear margins. This surgery is usually scheduled in 2 to 3 weeks, and the need for initial surgery does not change the prognosis. In closing, I want to remind you that you are in good hands here at Faulkner Hospital. Our team of dedicated healthcare professionals are here to answer your questions day or night. Should you or your family have any questions during this time, please contact your surgeon or nurse practitioner.